Hi, good afternoon. This is Derek Anderson. We're joining you from Northern Westchester Hospital. Thank you for joining us again. If you'll be hang with us for just a moment, we are setting up on our Facebook Live, so give us about 30 seconds and we'll be right back with you. Okay, good afternoon, everyone. Thank you for joining us again. This is Derek Anderson. I'm the Executive Director of Northern Westchester Hospital here in Mount Kisco, part of Northwell Health. This is our fourth community update. We're grateful that for those of you who have joined us for previous updates, today's topic is quite timely, and we're hearing a lot about this in the media around testing, specifically around serology or antibody testing. We're joined with us today by Dr. Marla Koroly, who's the Chief Medical Officer, Senior Vice President here at Northern Westchester Hospital. Marla was with us on one of the first webinars. And Dr. Dwayne Breining, who is the Head and Executive Director of Northwell Health Laboratories, based in Lake Success, which has been providing in a really leadership and incredibly strong way that all testing capabilities for Northwell Health facilities, outpatient facilities, as well as HHC systems. So Dr. Breining, thank you for joining us. Marla, thank you for joining us back.
My pleasure.
So really, we want to get started with just a quick announcement to our community that for the last several days, we have been providing antibody testing to the first responder communities that we serve here in Northern Westchester, which includes about 14 of the towns that surround us. And we're grateful for the partnership of our town supervisors and our local mayor here in Mount Kisco, Mayor Pickenich. Thank you to the town leadership and for helping support us through this. And so our governor a couple of weeks ago announced and gave direction to the hospitals around COVID antibody testing as well as diagnostic testing. And specifically for these populations, the hospitals and the healthcare providers, those offering this test, are being asked to prioritize certain groups initially before community-wide testing is made available. And so with that, with a lot of planning with our local town leadership, we've been doing that for our local police, our VACs, EMS, fire, and DPW or highway workers. And so that's been going extremely well. Just in the last day or so, we've had about 85 of these local first responders who are out on the front lines during this, who have come and received antibody testing. But before we get to too much into this topic, I'd like to just ask Marla, Dr. Koroly, if she can share another important topic that's been on, I know, a lot of your minds and certainly ours as we look to restart healthcare, restart the community, the economy. And this topic is quite time sensitive, really, because we don't want to, we want people to not delay healthcare. And so Marla, with that, can you spend a few minutes kind of walking us through this topic? This was a topic that we spoke about last time with Dr. Mutabar and Dr. Rosenberg, specifically on surgery and our OB programs. Marla, Dr. Koroly, can you spend a few minutes talking about this?
Sure, yeah. So I will talk in a minute about our plan for restoring our services. But before I do that, I just want to talk as what Derek alluded to is a very disturbing trend that we're seeing. So I want to take the opportunity to speak to all of you in our community about what we're seeing. So basically, people are waiting too long to seek care in our emergency department. In our emergency room, we've been seeing about half the number of people every day that we usually see and that we were seeing prior to this pandemic. So I want everyone to realize that you are safe in our emergency department. Everyone who enters puts on a mask at the entryway. They're screened for COVID-19 symptoms, and then you are taken immediately to one of our 26 private rooms. The reason we're so concerned is that there are certain conditions that are very time sensitive. So for example, before the pandemic, most people that came here to our emergency department with appendicitis came before their appendix ruptured. 90% of the time, the appendix had not ruptured yet. Now, half the time, by the time people get here, because they're waiting, the appendix is ruptured. Similar problems with stroke or heart attack. People are having stroke symptoms and they're waiting more than a day before coming to the emergency department. And that takes away the opportunity at times to get some time-sensitive treatment that can actually reverse some of the stroke symptoms or improve the heart attack outcome. So by waiting, it may cause harm, and that's what we're concerned about. People are afraid to come here, but I want to just get it out there that it is safe. You're not going to get COVID from coming to the emergency room, and delaying care can lead to harm. So in general, we have a whole plan that we're working on to restore all of our services in a very safe, thoughtful, careful way. Much of this is in accordance with New York State Department of Health guidelines. So on April 27th, which was a Monday, we started to open additional operating rooms so that we can accommodate time-sensitive surgical cases. We call these Tier 3. And what we mean by Tier 3 is that we postponed these surgeries for a few weeks initially, but waiting longer and longer could potentially be detrimental to someone's health and the outcome. For example, surgery for cancer. You don't want to wait too long and let the disease progress. So we started to open for those types of procedures in a very safe way. All patients and visitors and staff that come to the hospital have their temperature checked on arrival. We have designated nursing units to care for patients who currently have COVID-19, but we don't mix patients that don't have COVID-19. So anybody coming for surgery, the pre-area, the post area, and during the procedure is completely separated from any COVID-19 unit. We also test all patients who are scheduled for surgery and other procedures prior to coming in for coronavirus within 48 to 72 hours prior to their procedure. So we know that that person is negative and we have them self-quarantine, isolate for the 3 days before. And of course, as always, we adhere strictly to our cleaning and decontamination protocols in every area. We're lucky that our hospital has all private rooms, so that's never an issue. And we have ongoing standards of using appropriate personal protective equipment like masks and eye protection and complete adherence to all hand hygiene. So all of that keeps it very safe. Throughout the whole pandemic, of course, we continue to operate key services such as labor and delivery, which cannot be postponed. We safely delivered over 310 babies during the pandemic, and we're continuing all of our safety precautions in that area. And we're also working on slowly and safely resuming some of our other outpatient services, which happen at Chappaqua Crossing, again, in a way that is very safe, consistent with social distancing, spreading out the waiting area, spreading out appointment times, and numerous other cleaning standards that, again, are consistent with guidance from the New York State Health Department. So that's our plan.
Excellent. Thank you, Dr. Koroly. So it's pretty clear that the hospital and the teams and the medical staff are doing literally everything possible to assure that we have COVID contained and that really to not delay healthcare. And so this message is important for us to get out there, and please share this with your social networks that it is important that the hospital is safe. And Northern Westchester has been here for you for many years. We will continue to be here. And really that it has already been so disruptive, this pandemic, on all of our lives. Please don't hesitate. If you have questions, contact your doctor, come to the ER if needed. But that's really an important message. So thank you, Dr. Koroly, for helping articulate what the plan is. So let's just pivot back to serology testing. Dr. Breining, can you help us understand, I think, first of all, what's the difference between serology or antibody testing and a COVID diagnostic test?
So sure, with the COVID diagnostic test, it's done by a methodology we call either PCR, and now there's a type of testing called antigen testing, which is coming on the market. That allows you to test a patient for the actual COVID virus particles, either the nucleic acid or some of the proteins, at that particular point in time, whether they have it. What the serology test allows you to do, or the antibody test, is it tells us whether or not a person has been exposed to COVID at any time in the past, really. So we know that many of the people who we would have liked to have tested by the PCR diagnostic methods at the time of the outbreak being at its most severe were not able to get tested. So what the antibody test allows you to do is you can identify which patients may have been exposed to it in the past, and maybe they didn't even know it, because we know that people can have asymptomatic infections. And by doing the antibody test, you can tell that. You can tell what the prevalence rate is in a community by testing a community or a certain population.
Excellent. So is this a nasal swab? Is this a blood test? How are we doing serology testing?
Serology testing is a blood test, so it's done by a regular blood draw, just like you would get for the usual laboratory tests that we do, the chemistries and electrolytes and things like that. Same tube, same process of phlebotomy, comes to the same laboratory down here at the core lab in Lake Success. For Northwell, we do the testing, and we've been doing it for a few weeks now.
Excellent. Thank you. So just a quick reminder, we're joined here by Dr. Dwayne Breining, who is the Executive Director, the head of Northwell Health Laboratories, Dr. Koroly, our Chief Medical Officer here at Northern Westchester. We're talking about serology testing or antibody testing for the community. And this is a great way to ask questions. If you could ask questions on Facebook Live or via the Q&A on Zoom. But please go ahead and start submitting questions. And in a few moments, we'll start to tackle some of those questions. So Dr. Breining, you take this, it's a blood test. What type of result do you expect? Is it, we're hearing that you're either positive or negative. And what does that mean?
Yeah, what we're doing is we're testing for the presence of antibodies that are specific for the COVID infection in the blood. And if you have those antibodies, it means that you've had this virus in the past and your body's immune system has responded to it. And sometimes people don't even know that they had the infection. Some, especially younger people, it seems have less severe infections. And we've come across a number of people who've come back positive for antibodies and they don't even remember being sick. But also there are many other people who were sick back in the past few months, didn't think that they had it, but it turns out that they did have it. And then other people who did think that they had it based on the symptomatology, but they weren't able to get tested for whatever reason at that time. And now they can confirm that indeed they had the COVID infection.
Excellent. And how accurate are these tests?
We've put these tests through extensive validation testing in our own laboratory to make sure that they are specific for the COVID infection. Many people don't know, but there are other types of coronaviruses that cause a seasonal flu-like illness that accounts for about 10% of the flu-like illnesses every season that we see in our communities. And our most important concern was making sure that the tests were specific, that they would distinguish between antibodies for the COVID-19 infection and not mistake antibodies for the seasonal coronavirus infection to be COVID. We're happy to report that the only tests we're running are tests that pass those validations with flying colors, and they're in the high 90%, 99% or above specificity for the COVID-19 infection. That's about as good as it gets. No serology test is 100% specific from distinguishing against all other types of antibodies, because your immune system, tries to make antibodies that cover the broadest amount of viruses possible. That's the way your body defends against infection. So there's a lot of science to this, and we made sure we have the best tests that are on the market right now.
So based on what you're saying, Dr. Breining, for somebody who's tested positive for COVID, does it make sense for them to then take an antibody test?
Sure, if they want to see if they can confirm that they had an antibody response to it. For a number of different reasons, some people who have an infection never develop antibodies to that infection. That can be for a variety of reasons. Sometimes people are on medications. You may have heard that you don't get a vaccine shot if you have a high fever. They recommend that you don't do that. So if you have another infection at the time that you get a secondary infection on top of the infection you have, your body's immune system may not respond in the same way. So one of the ways you can confirm that you've made antibodies to the COVID-19 infection is by getting this antibody test.
Great, excellent. And so a couple of quick questions that came through Zoom. Are we able to share what is the name of the test or the name of the manufacturer? And is it EUA by the FDA? This is Susan and Stephen are asking via Zoom.
Yes, so we're actually running a number of tests. We're running 5 or 6 tests from different manufacturers, and they're all the major diagnostic manufacturers that you may have heard of: Ortho Diagnostics, Abbott Diagnostics, Roche Diagnostics. All of these tests have been authorized for emergency use by the FDA. And then we, as well, did our own extensive validation to ensure the accuracy of the tests.
Great, excellent. And are these serologies IgM or IgG is a question from someone.
Most of our tests we're reporting out IgG only, although some of the tests do a total antibody, which includes both IgG and IgM as well as IgA. And when they passed our validation, we're using those in some circumstances. We tend to stick to reporting out the IgG because in our experience, that's the one that's been most associated with a long-lasting antibody response. The others tend to be more acute reactants and can be less specific than the IgG.
Okay, excellent. We appreciate you getting technical with that. There's a question around the connection between donating blood and somebody who has a positive antibody test. Can you just speak to that? Should somebody donate blood, or are we encouraging people to donate blood if they test positive for antibodies?
Sure. So there's actually a treatment for the COVID-19 infection called convalescent plasma treatment. And this is basically blood transfusion or plasma transfusion into a patient who has the COVID infection from a patient who's had it and recovered from it. And what can happen, we think, and it's been used, this type of treatment has been used for over 100 years in a variety of different infections with some success, that the antibodies that the donor has can actually help the recipient if they're sick. So there's a number of trials underway, both in Northwell institutions and other institutions where this can be done. If you've had a prior COVID infection and you've recovered and it's been, you've been tested for the PCR diagnostic test, you may not even need to have the antibody test. But if you think you had the COVID infection and you weren't tested for the PCR test, you can get the antibody test, which will confirm that you had the COVID infection. And then you can contact the blood center or wherever donations are accepted. And you can find out what specific protocol they have. You may not need to get further testing, or some places have a more detailed testing algorithm that they use, depending on which specific protocol they're on. And the goal of these protocols is to understand exactly how helpful this may be for the afflicted patient population. Until you do controlled studies and trials with enough people in different control groups, you never know for sure whether the treatment you're giving is helping the patient population or not, unless you control these experiments very carefully. Don't forget, 98% of the people who have the COVID infection will recover on their own. So it can be pretty difficult to know whether the treatment you're giving is what accounted for them getting better, or whether they would have gotten better without the treatment. So that's what these studies are designed to prove.
Excellent. Very good. Thank you very much. A question is coming up. How long does it take to get the test result back? And to follow up to that, if you could also speak to, if your antibody test is negative, what should you be doing differently, if anything? And so how long does it take? And then what do you do if your antibody test is negative or positive? What are we getting correct?
It's good news. We're telling people it might take up to 4 or 5 days to get the results back, but so far we've been able to keep up with the demand, and we're getting most people back their results within a day or two. And hopefully we can continue that. We have a bunch of machines that run multiple tests. That's one of the reasons we're running multiple tests, so we can do more tests at the same time and return results faster. And then the next question was, should you do something different? And the answer is no, you shouldn't do anything different other than maybe contact your blood center about donating convalescent plasma and getting enrolled in maybe one of these studies that could help other patients. Everyone, whether you have antibodies or not, should still follow all of the social distancing and protective measures that have been put in place. I think everybody knows at this point that when they have an antibody response, which is evidence that they've recovered from a prior COVID-19 infection, that they are likely to have some level of immunity to future COVID infection for a season, maybe a little bit more than one season. But nobody really knows what that level of immunity is, because this is a brand new virus. These are brand new tests. We should know that answer within the next couple of months as we test more people and we can follow through with them. But we honestly don't know whether it's a 60% immunity, whether it's 99% immunity, or whether it's even 0% immunity until we do those studies. And don't forget, even if you are immune, you could still go visit grandma and put her at risk just by carrying the virus, on your body's surface, even if you're not actually infected with it. So those precautions are the right thing to do, whether or not you have antibodies.
Yeah, excellent. And I appreciate you mentioning that, because that's certainly, as we've been testing our team here at Northern Westchester, a lot of our frontline healthcare workers, and I know you've been tackling this for the health system, Northwell Health as a whole. And I believe this morning we heard the statistic that we've processed, or most of the team of Northwell, close to 45,000 of our team have gone through antibody testing. So it's important to note that if you do have, just to reiterate what Dr. Breining is saying, even if you do test positive, you still need to be very particular about practicing good social distancing, good hand washing, covering your face, and certainly connecting with your provider if you have any symptoms or you think you've been exposed to somebody with COVID. That's incredibly important.
Thanks for mentioning that. We have tested over 45,000 of our own staff so far. And the good news is preliminarily, with the trends we're finding, it shows that the preventive precautions that we're taking in the healthcare setting seem to be working. The prevalence rate of our own staff that we've tested has been about the same as the local community, which is evidence that there's not a greater risk in the healthcare setting for our employees, which again shows that the social distancing, the hand washing, the masks that everyone is wearing are working. And we're finding that we've tested a lot of first responders on Long Island as well. And it's a very similar pattern. Their rates of infection, even though they've been exposed to more patients, are not any higher than the prevailing community prevalence rate, which again tells us that the protective measures that they're taking are working, so that we know how to prevent the spread of this. And we're reassured that a lot of the precautions we're taking in the hospital do indeed make it a safe place to come and a safe place to work.
Yeah, excellent. Thank you for saying that. There's a question on social media, Dr. Breining, around if you have had COVID, you receive the antibody test, your test comes back positive. Does this in any way change whether you'll be eligible to receive the vaccine when that were to come out?
I don't know what the policy is on that until the vaccine, actually comes out. I think that's getting significantly ahead of the game, because we're probably a year or so away from a vaccine. But based on our experience with other vaccines, it's not likely that anyone would be restricted from getting the vaccine, because even if you have some degree of immunity to a disease, the vaccine would boost that immunity. And that's what we do in other situations with other communicable diseases that have vaccines.
Great, excellent. Now, what about retesting? Let's say you get the antibody test and you come up negative. Should you be retested at some point?
Yeah, at some point in the future it would make sense, because again, you can have silent infection and silent exposure to the infection. So that's one of the things that can occur. Also, if you've got the infection, it takes about 10 days to 2 weeks for the full antibody response to develop. So if you happen to be caught in that window where you have the virus, but you've only had it for a couple of days, you may not have developed an antibody response to it. So, coming back after a couple of weeks and getting retested may be a reasonable thing to do.
Great, excellent. Chris on Facebook wants to know whether the antibody test will tell you if you presently have the virus.
It's an interesting question. Generally, the antibody test is not recommended as a diagnostic test. Now, most people will start developing antibodies immediately when they get the infection. So you will inevitably pick up some people who have active infection by doing the antibody test. However, because of that window period that I just talked about, the antibody test is generally not a good test to use for diagnosing whether someone has the virus at any particular moment. The PCR test is a much better test for that.
Okay, excellent. Thank you for clarifying that. And just to follow up, there's a couple of questions around the topic of, are all Northwell, all tests that are being administered by Northwell Health cleared by the FDA, or just some of them?
All of the tests that we're administering are authorized for emergency use by the FDA, which is the only way that any of these tests are being approved at the moment for COVID-19. So the FDA does review some data on these tests from the manufacturers, and they grant authorization for that test to be marketed for emergency use during this COVID epidemic. Once the pandemic is over, then they will re-review all of these tests going through the full FDA approval process. But they have had some FDA review, and the companies have submitted data, and then all the laboratories that are using the test like ours are required to do our own validation data. And we've done very extensive validation on the tests that we're running.
Excellent. And how quickly, if somebody wants to go ahead and get an antibody test, do they just reach out to their Northwell provider? How do they go about that? We're going to talk in just a couple of minutes about what Northern Westchester Hospital, in partnership with Dr. Breining's team, are going to be offering for prioritized groups. And I'll go through that in just a few moments, so hang with us. But broadly, the question is, if today somebody wanted to go get antibody testing, how typically would they pursue that?
You've got it exactly right. You should talk to your usual healthcare provider. The testing, now that we're ramping up the testing capacity very rapidly in our lab and in other labs as well, by and large, your regular healthcare providers are getting access to the testing, and they'll be able to make arrangements with you to order the test like they order any other blood test.
Excellent. So let's just pivot for a couple of minutes. There's a question around preparing their child for college and sending their child away to college. Certainly there's still a lot of uncertainty around when colleges will reopen, but what should parents be thinking about now regarding testing as kids are potentially going off to college? Should they be doing preventative testing in any sort of way? If so, what does that look like? What would you recommend as far as preparing somebody for, or what should they be recommending to the college for these students coming back?
Yeah, it's an interesting question. I think as these types of institutions are opening up, you will see guidance coming out of those institutions. And there will probably be some reconciliation of this at the state level where standards will be put forward as we get into the planning for how these places are going to open. To my knowledge, there haven't been any standards yet released for what type of testing will be done there. But I know a lot of places where there's going to be a setting where large amounts of people are going to be aggregating together, perhaps in an environment where social distancing is not possible. Places are trying to develop screening algorithms for people coming in. And right now it's going to be different institution by institution. But I imagine as the states get closer to organizing how they're going to reopen these types of institutions, they'll be putting out guidance that everybody will have to follow.
Yeah, great. And just to clarify, following that same path, everything that Dr. Koroly spoke about here at Northern Westchester, the steps and the diligence that we're taking to protect our patients and our staff, that extends to all of our locations within Northwell Health. And even more so, we're talking about serology testing at our locations where we're doing blood draws. So specifically in our community, you have a number of locations, Westchester Health Associates, which is Northwell Health Physicians, but we have a location down at Chappaqua Crossing next to Whole Foods. It is the Center for Healthy Living. We actively have been doing blood draws there for several months, and all the same rigor that you're going to see at the hospital with masking and checking temperature upon arrival, screening questions, hand sanitizer, all of those measures are being done at Chappaqua Crossing and at really every Northwell Health facility across the network. So just a quick check-in, Derek Anderson, I'm the Executive Director of Northern Westchester Hospital. I'm joined by Dr. Marla Koroly, our Chief Medical Officer and Senior Vice President here at Northern, as well as Dr. Dwayne Breining, who is the head of Northwell Health Laboratories, the Executive Director. And so we appreciate both of them joining us today to talk about serology testing. There are a lot of questions on access to testing, where can I get testing? And we're gonna kind of wrap up the conversation in just a few minutes on that and give you very specifics on what the plan is right now within Northwell, within Northern Westchester Hospital to accomplish that. But before that, we wanna get to just a few more kind of detailed level questions on serology, and one that I'll ask Dr. Breining to help us answer is how much does the test cost, and is it covered by insurance? Are there co-pays? I know every insurance may be different, but broadly, is this something, because it's a new disease, it's a new test, is it covered by insurance? And if so, or if not, how much does it cost?
Yes, it is covered by insurance. In fact, your insurance companies are mandated to cover the cost of COVID testing. I don't know the exact prices. I think the price of the serology test, the antibody test, is in the ballpark of about $65 is where the cost is. So it's about the same as a lot of other blood tests that would go through. And the insurance does cover it. Whether or not you need to pay a copay, I think depends on your individual insurance policies, but they all do cover the cost of that testing.
Great, excellent. And So we're talking about serology testing. We've talked a lot about the individual result of whether positive or negative. If it's not changing practice and we're not supposed to be doing anything different with a negative or positive result, what is the value of this serology testing widely? And how does this connect back to everything we're hearing in the media and from our senior government leaders around reopening the economy? Can you just speak to the value of it, maybe at a more broad or a population level?
Yeah, I think that's a great question, actually. We're very reluctant to make any firm statements about how the presence of antibodies may or may not relate to a person's immunity from getting the COVID-19 infection again. And that's because it's a brand new virus. Now, based on our experience with all the other types of coronavirus and the data that's emerging from this COVID version of coronaviruses, it seems that prior infection and recovery generally does provide some level of immunity from reinfection. But we don't know the exact answers on that yet. By testing many people, it both gives the person the information as to whether or not they've had the infection and they may have recovered from it. But it also gives information about the prevalence of the disease in that population, no matter how big or how small it is. It could be at the family level. If you know somebody in your family had this disease, well then, everybody's wondering whether or not they would have caught it if they're in the same household. This gives a way of testing that. But then also by reviewing the data in different communities and looking at the seroprevalence data of how many people in a given community, say our first responders, have evidence of having this disease, we can tell in which populations it has spread. And more importantly, we can link that back to the protective measures that may have been taken or not taken in those populations. And we can tell which practices are effective and which practices are not effective. So it's an important way that guides us as to what kind of protective measures we're going to take, for instance, in our hospitals and healthcare institutions. If we see that something doesn't seem to be working somewhere, we'll study that very intensely and make sure we change it to things that are working. And like I said, we're happy to report that in the testing we've done so far, it seems like the protective measures that we're taking by and large are very effective. And I know there's some concern that this virus is some sort of super virus that can spread, by ways that are previously unknown till now. And as the data emerges, and we've confirmed it with our own data, it seems like that's not the case, actually. It seems like the measures that we take to prevent things like the flu during a busy flu season from spreading seem to be by and large pretty effective for this particular virus. So it gives us an increased level of security that what we're doing is the right thing and can guide us toward doing the right thing. And then eventually, as more data emerges, as more people get tested, we will be able to start making more firm statements about what your immunity likely is based on your antibody status. We're not ready for that yet, but we will be in the near future.
Yeah, excellent. So, Dr. Breining, is it a safe statement that ultimately the goal is to get as many people in the community tested as possible so that we can have that population-wide data for our communities? And then maybe if you can just speak high level, and I'll also jump in on this topic of what is the phased approach? How are we going to get from offering antibody testing today to first responders to this point where we can test potentially thousands or millions of New Yorkers?
Yeah, so we're ramping up testing as much as possible, as fast as we can. Currently, we can do over 10,000 tests per day in this lab, and we hope to, double that in the coming week or two. And the idea is indeed to test as many people as possible. Again, expecting that antibody status will say something about your immunity, will certainly say something about the disease prevalence in a given community and therefore the risk or lack of risk to a given population. So as we ramp up that testing capacity, that will lead to increased test availability. We are going through the first responders now. We are more than halfway through testing the 75,000 strong workforce for all of Northwell Health. And we intend to keep going until everybody who needs or wants to be tested can be tested.
Yeah, excellent. And to bring it home here to Northern Westchester communities, we mentioned earlier that a couple of days ago, we started, as Dr. Breining alluded to, doing antibody testing for our first responder community. And just to be clear with what the governor of New York has put out, that there are specific populations that should be tested first. And I just want to read off a few of those because the question is coming up. Why not go to the community first? You know, I'm going to compare this early on to diagnostic COVID testing. And you heard this a couple of months ago. As capacity increases, the availability of these tests will increase. For now, as testing is being ramped up, and 10,000 certainly is a tremendous number, you think about the millions of New Yorkers, it's not quite there. So in the meantime, the state Department of Health has asked healthcare providers like us to prioritize certain populations, mostly those who are having interactions within hospitals, our physician offices. The next phase after really frontline healthcare workers, we mentioned our first responders, police, fire, EMS, our DPW and highway workers. And then really the goal is after that, that we are going to start to open it up potentially for the broader community, which includes all essential workers. These are grocery store workers, restaurant owners, bank tellers, mail workers, dental offices, medical specialists in the community, hotels, funeral homes. You know, the list kind of goes on, but we think about that next wave of essential workers as the state defines it. And so please stay tuned as Northern Westchester Hospital continues to offer testing here at the hospital, as well as in Chappaqua, at Chappaqua Crossing, our outpatient lab location next to Whole Foods. Our goal is within a few days or a week or so that we are going to be in a position to go to that next phase and focus in on essential community partners that should get tested earlier. And I will mention that a lot of this is in partnership with the Westchester County Health Commissioner, Dr. Amler. I've spoken to Dr. Amler a few times. She is the ordering physician on these tests, and she receives in aggregate the information so that she can see, as Dr. Breining alluded to earlier, that population-wide data to help inform where broader antibody presence may be. And that partnership with the county is important as we look to offer even more wide that next phase. And then eventually, as we mentioned, that we do want to do community-wide testing, and that'll really depend on our ability and our Dr. Breining's team as that continues to ramp up. But just keep in mind, just to reiterate, that a lot of the focus right now is getting those frontline workers and first responders tested, with the goal soon to then broaden that to essential community business owners and workers. And then the next phase after that is potentially the broader community. If you have a question really about any of this, I'm going to go ahead and share our website, and which will give you more information. We are going to post about this later tonight, first thing tomorrow. So please check out the website, and it'll give you a little bit more specifics on how to sign up, what these groups are, and it's a little more clearly defined. If you fall into one of these groups, you can check that out. So let me just go ahead and share our website. You can see it at nwhc.net. So go to nwch.net. You could also sign up for the newsletter. That's a lot of information we send out on a regular basis about some of this as well. So I just want to make sure our community is aware that we're taking a very thoughtful, strategic approach to focusing on those populations that the governor has asked us to focus on in the Department of Health. which are those frontline and community-based workers. The goal is ultimately to get to the broader community.
I just want to add that I saw a couple of questions about whether people need a prescription from their physician to have the test. So if you're part of the group that we're testing, you know, first responder and eventually essential employee, you do not need it. It's a whole program. We have a standing order under me or a different physician. So you can just come as part of that program and get tested. And then once we roll it out to other people in the community, then we'll let you know which groups may need a prescription from your physician and which don't. But at this point, if you didn't fall into one of those groups that we're testing specifically, the first responder or eventually the essential employee, then to get this test, you would need a prescription and come to our testing center at Chappaqua Crossing.
Yeah, excellent. Thank you, Dr. Koroly. So as we wrap up, we just want to emphasize a couple of points that are important for our community to know. And the first is Dr. Koroly spent a few minutes at the beginning talking about not delaying care and how important it is to seek out your physician or the hospital for medical care. Certainly over the last couple of months, there has been a lot of fear around going anywhere, and in particular the hospitals, as we've been kind of fighting on the front line of this pandemic. But we're very much in a position here at Northern Westchester Hospital. We're down to, as of this afternoon, less than 20 COVID positive patients, all of whom are segregated into a very specific unit of the hospital, clearly separated from the rest of the hospital, and very clearly separated from our operating suite and our pre and post surgery areas. And so please, as we're seeing cases of patients come in who have been delaying care and typically results in a much more complex situation, please don't delay. And I think a lot of our community understands that seeing your primary care physicians or specialists often detect potentially more of a complex underlying issue. And so we strongly encourage everyone to, if you have questions, call us, call your provider, but please don't delay care. It's kind of most important. We've been talking about serology or antibody testing. The hospital, Northern Westchester, in partnership with Northwell, we've been doing antibody testing for the past few days for our first responders. Very soon, we're going to be ready to go into our essential business workers and owners who are also out in the community interfacing with people. Go to our website at nwhc.net for more information. We are going to post more tonight so that you can have a very specific understanding of which and whether you fall into the governor's clear direction on prioritizing certain populations. And keep in mind, even if you do get a serology test and you come back positive, which means your body actively fought the COVID disease and your body has now built up some level of antibodies to fight it off again at some point, potentially. A lot of unknowns about this, but whether you're positive or negative for a serology or antibody test, it's important that now more than ever that everyone please continue to practice good social distancing, good hand washing, cover your face with a mask when in public, and certainly report to a hospital or to your provider if there's any questions, and then B, if you have any symptoms that you think might. Now, although the incident rate of our COVID in our populations have been decreasing, unfortunately, we're still seeing 1 or 2, sometimes 3 a day still present. So there are still new cases, luckily not nearly at the level that it was a couple of weeks ago or even a month ago when it was at the peak of this pandemic. But please, now more than ever, we're hearing this also from our state leaders that it's important to still follow the guidelines, follow good social distancing practices so that we prevent any sort of outbreak. With that, as we wrap up, we appreciate you joining us. Dr. Breining or Dr. Koroly, is there any last words that you'd like to mention to the group before we close?
So for me, again, just to reiterate, there are certain severe symptoms, chest pain, neurologic stroke symptoms, weakness, trouble speaking, severe abdominal pain. Those are emergent, time-sensitive conditions. So please, if you have that, don't wait and come to the emergency department. It is safe. And then the second point, which I think we've said multiple times, but I want to say it one more time, the antibodies do not change what we do at the moment, but someday they will. So as Derek said, the social distancing, the masks, the hand hygiene, don't give that up. But at some point we'll have so much more information and we'll be able to use these antibody results to guide people, just not yet.
Great, thanks, Dr. Koroly. Dr. Breining, any last comments?
Yeah, I'd reiterate that, keep following the precautions. I think we're now learning more that, we understand how to stop the spread of this thing, and it's largely going away because of the social distancing and because of the precautions we're using, both out in the general public, but also in healthcare institutions. We're showing that by and large, the measures we've put in place have been effective. And that is the reason that our curve in the New York region has reversed and our cases are going down. It's not because of any seasonal changes in the way this virus spreads. I know some news channels are sort of garbling the message a little bit on that, but there are places where it's much warmer than it is here, and their outbreak is getting worse. It's all due to the precautions we put in place. We know how to control this thing. Let's keep doing it, and we'll keep this in a place where it belongs.
Excellent. I think that's a great way to end. Thank you, Dr. Breining. Thank you, Dr. Koroly. Appreciate everybody joining us this afternoon. Thank you for those of us who joined on Facebook and Zoom. Have a great afternoon. We are here for you. And we hope everybody continues to be well. Take care.
Be safe. Thanks.
Bye.
Thanks.